Assalamualaikum warahmatullahi wabarakatuh. Today I would like to present about my topic Catheter-Related Bloodstream Infection CRBI. My name is Raja Iza Adina binti Raja Khairuddin Shah and I'm from UNICEF. First, the aim of my study is to study about bacteremia infection like catheter-related bloodstream infection and correlate laboratory findings with the patient medical history in order to study the case. Introduction. The patient is a 54 years old Malay woman who had an end-stage renal failure, that is ESRF, and dyslipidemia, and her fever spiked at 38.5 Celsius. She was unable to proceed her hemodialysis due to bruises. Overview of the illness or of her condition. Catheter-related bloodstream infection is defined as the presence of bacteremia originating from an intravenous catheter. It is a common cause of nosocomial infection. The patient has had ESRF, which indicates CRBI through hemodialysis. The laboratory findings show elevated white blood cells during the first 2 days, high C-reactive protein (CRP), low hemoglobin, low total red blood cells, low MCV, and platelets. For the outcome of the laboratory investigation, this is for the C-reactive protein, that is CRP, and then the normal range of the CRP is 0.5. You can see the patient's reading for the CRP is higher than the normal range. For the renal profile, this is for the renal profile. For the urea, the normal range is 3.2 to 8.2 until 8.2. The patient's reading for the urea is higher than the normal range. And for the sodium, the normal range is 132 until 146. The patient's reading for the sodium is lower than the normal range. And for the chloride, the normal range is 99 until 109. For the patient's reading of the chloride is lower than the normal range. For the full blood count, this is the full blood count. For the hemoglobin, the normal range is 12 until 15. The patient's hemoglobin reading is lower than the normal range. For the total red blood cell, normal range is 3.8 until 4.8. The patient's reading for total red blood cell on the first day is lower than the normal range. And for the white blood cell, you can see that the normal range is 4.0 until 10.0. You can see that the patient's reading for the white blood cell on the first day is higher than the normal range. And for the hematocrit level, the normal range is 36 until 46. And you can see the patient's hematocrit level is lower than the normal range. And for the MCV, the normal range is 83 until 100 level. And for the patient's MCV is lower than the normal range. And for the MCHC, the patient's reading for the MCHC is higher than the normal range, that is 31.5 until 34.5. And for the platelet count, the patient's platelet is lower than the normal range. And for the MPV, the patient's MPV reading is lower than the normal range. the MPV is higher than the normal range. For the neutrophil level, the patient's neutrophil is higher than the normal range on the first day. For the lymphocytes, the patient's lymphocyte is lower than the normal range. For the monocyte, the patient's reading is normal, within the normal range. And for the eosinophil, the patient's eosinophil reading is lower than the normal range. And lastly, for the basophils, the reading is normal, that is within the normal range. For the microbiology report, first the specimen type the patient has tested is the blue lumen, and the test is gram stain. For the gram stain test, the blue lumen has been identified the microorganism as gram-positive cocci, and blood culture test also had been done, and the result is positive. For the specimen type for the red lumen, the Grimstein test also indicates the specimen has microorganism that is gram-positive cocci. And for the blood culture, the result is positive and the organism has been identified as Staphylococcus aureus and the resistant marker show it as MRSA. Discussion. Height CRP. CRP is produced by liver. Height CRP indicates that the body has an inflammation. It might be inflammation in heart due to ESRF. It also might be infection due to hemodialysis, that is using of the catheter. Also, decreasing CRP level might be because of drug monitoring. For the low total red blood cells, it runs parallel with hemoglobin. The lower the total red blood cell, the lower the hemoglobin can be carried. It also might be because of the kidney failure. Also, low hemoglobin TRBC and low hemoglobin TRBC and MCV indicates that the patient might have anemia. For the low hemoglobin, it might indicate that the patient body might produce fewer red blood cells than usual, or destroys red blood cells faster than they can be produced, or experience blood loss. ESRF is one of the conditions that can cause body to produce fewer red blood cells. For the low MCV, it might indicate that the patient had microcytic anemia. Microcytic anemia might be because of chronic disease like ESRF. The patient's MCHC reading is also low. Low MCV and MCHC indicates microcytic hypochromic anemia. For the high white blood cells level, first 2 days the level went soar above the normal range. For the patient's condition, it might indicate the body was fighting the infection. For the 4th day onwards, the level went back to normal. For the low platelet count, the patient could not proceed with hemodialysis due to bruises. Bacteria in blood in some conditions may cause thrombocytopenia. The patient's MPV was higher. For the low platelet and high MPV indicates that the bone marrow is producing platelets and releasing them into circulation rapidly. This both situations when platelets are destroyed by infections or toxins. High neutrophils. The neutrophils level is high until the 3rd day and turn normal until the last days. High neutrophils indicate infections. For the low lymphocyte signs of an underlying illness. The patient had already been diagnosed with ESRF and dyslipidemia. Sepsis and kidney disease are 2 of the causes of lymphocytopenia. Low monocytes. On the 1st day of diagnosis, the monocytes level is normal. For the 2nd day, it went low. Bacteremia might be the reason of monocytopenia. When it went high the next day, it may indicate the patient had infection. For the low reading of basophil, it means that it took longer time to heal an infection. For the high level of urea, the patient may facing decreasing blood flow to the kidneys. It also indicates that the kidney could not functioning well. Low level of sodium may indicate kidney disease. Low amount of sodium means that high amount of potassium. High potassium can impair the heart. Patient took forced vital capacity test to assess heart disease. High lactate dehydrogenase. It may be seen with infection, sepsis, and kidney disease. Positive cocci. Grimstein for blue and red lumen. Blood culture is also positive and is a gram-positive cocci. Staphylococcus aureus was identified. Methicillin-resistant Staphylococcus aureus (MRSA), resistant to an entire class of antibiotics called beta-lactams. The antibiotics include oxazoline. The patient has been diagnosed with bacteremia by MRSA. Patients who have had surgery or weakened immune system are at risk. Conclusion. In conclusion, the patient with CRBI showed many abnormal medical data during her diagnosis in the hospital. Patient's high level of white blood cells indicate that she has had infections, but the reading gradually changes over time might be because of treatment the patient has received, that is, drug monitoring. The decreasing dose of vancomycin indicates that the patient's condition is turning better over time. That's all from me. Thank you.